conference started off with noticeably empty chairs. The allegations surfaced days before the event, resulting in tensions, confusion, and the untimely withdrawal of some delegates. The issue is centered around one of the conference main sponsors, whom allegedly had previously accepted money in 2021 to do a study for the tobacco industry, a move that the conference believes could have potentially derailed the event this year.
About 12 days ago, we heard from the World Health Organization speaker that he could not attend anymore because, and these were the words in the email from him, the conference organizers, FPD, is funded by the tobacco industry. This was a complete surprise to us, and we then tried to get more information, and it turns out that FPD has received a small amount of funding to do a study looking at the interaction of cigarette smoking and COVID-19 from a foundation that is called the Foundation for a Smoke-Free World. Long story short, it turns out that this foundation is a smokescreen, sorry to use that word, perhaps I should say front, of the tobacco industry.
Experts say that the COVID-19 pandemic has put the treatment of TB on the back foot. Reduced access to TB diagnosis and treatment has resulted in an increase in TB deaths and globally a notable spike of infections. Over 25,000 people die from tuberculosis each year in South Africa.
Statistics are really showing that while we have done relatively well before COVID, during COVID, globally we have seen an increase in the number of deaths on TB, and we wish to actually change that situation. This must stop.
Calls from some civic organizations for more of a collective approach by organizations in combating the prevalence of TB in communities, as opposed to some working in silos.
We need to encourage all partners, particularly those who work in SANEC and in other spaces, to invest in TB and take initiative in ensuring that we prioritize TB in all levels, not just at national level, but we want to see TB interventions that are led at provincial levels, at district level, and most importantly, at local levels.
South Africa has been rated by the World Health Organization as one of the 30 countries accounting to 86% of the global TB burden. The four-day conference will see over 1,500 delegates, consisting of policymakers, scientists, civil society groups, and health professionals, convening to come up with strategic ways to fight TB. Jade Paulser, SABC News, Durban.